I would say in regards to clinical learning, it's important to remember that many of these students are emerging adults, 18 to 21 years old. And for many of them, it's their first time caring for patients who are suffering from multiple chronic conditions or facing the end of life. But nursing students are learning to care with these added restrictions of COVID, where many patients are alone without their family members to support them. Learning the nursing professional competencies of providing compassion and care to others are extremely emotionally draining. It's not an effortless skill. And this is where students can run into trouble if they don't have the coping skills to support their emotional needs as they move forward through their clinical learning. And just as Joy was saying, and Deb, taking that step back as you see what the patient is going through is a skill to learn. And we can learn that through compassion training. So nursing students must learn to give compassion to others. That's part of their core competencies. And this involves their ability to perceive and manage their own emotions, but as well recognize the emotions of others and the effects of their emotions on themselves. But this is challenging in those high stress environments, such as the emergency room or an acute care floor or ICU. And these nursing students are exposed to this and they're encountering this increased level of stress, which also increases their risk for depression, which is concerning because there's an already high global prevalence of moderate to severe depression in nursing students at about 34%. We know that depression is a predictor of suicide. And as Deb had mentioned, recent reports kind of show that nursing students or nurses are at a higher risk of suicide than the general population. And this is concerning to nursing students as they pursue becoming practicing nurses.
That's very heart touching.